Welcome to another Journal Club session. I hope you enjoyed last month's topic that looked at the role of the nurses in partnering with mothers to give oral medication to their hospitalized child, modification and development of a contextualized evidence-based practice guideline. If you missed it, don't worry. You can always access it through the YouTube channel. Are you watching this alone, or have you gathered a group of colleagues to watch it with you? If you are alone today, maybe consider watching with colleagues next time. You can access a guide how to organize colleagues watching together in the description section below. This month's article is titled Barriers and Enablers of Implementing Bubble Continuous Positive Airway Pressure, or better known as CPAP, Perspectives of Health Professionals in Malawi. It was written by Nyondo Mipando et al. And published in the journal PLoS One in 2020. Let's first look at the graphic summary of the article. This graphic breaks down the different sections of the article and provides a visual summary. In this video, we will now unpack each section. If you have a copy of the article with you, you could track the sections of the article as I speak. We start with the introduction that you can find on the second page of the article. Preterm birth complications are the leading cause of neonatal deaths. Malawi has the highest rate of preterm births in the world at 18.1 per 100 live births. More than half of the preterm infants in Malawi develop respiratory distress, which can lead to respiratory failure and death if left untreated. Respiratory distress can effectively be managed with continuous positive airway pressure, or CPAP, avoiding the need for intubation and ventilation, which can come with potential added risks and complications. CPAP is safe, cost-effective, and considered an essential intervention for the management of preterm neonates by the World Health Organization. The effective use of CPAP is influenced by the availability of equipment and people's skills in its use. Bubble CPAP in high-income countries use centrally provided gases and are quite expensive. However, even in tertiary hospitals in Malawi, they don't have access to piped gases and oxygen. Researchers from Rice University developed the Pumani bubble CPAP system for low-resource settings with similar delivery of air pressure and flow to commercial bubble CPAP. Pumani is durable, easy to use, easy to repair, and is more affordable than commercial bubble CPAP. The aim of the study was to explore the factors that influence the implementation of bubble CPAP among healthcare professionals in secondary and tertiary hospitals in Malawi. Move on to the methods section of the article, where the authors explain how they gathered their data. You can find this on the third page of the article right after the introduction. The study was conducted in 3 district hospitals and a tertiary hospital in southern Malawi. This was a qualitative study where data was collected through in-depth interviews about the perspectives of nurses, clinicians, and clinical supervisors on working with bubble CPAP. Interviews were conducted from June to August of 2018. Participants were purposefully selected and consisted of healthcare professionals who were involved in healthcare delivery and/or decision-making for newborn care and included district health officers, district medical officers, district nursing officers, nurses that managed or worked in neonatal units, clinical officers, registrars, and pediatric consultants. A semi-structured interview guide was developed following a scoping literature review and preliminary stakeholder consultations. Questions addressed training, initiation, monitoring, differences in opinions, perception and personal experiences, and perception on caregiver understanding of bubble CPAP. The guide was translated into the local language of Chichewa before the interviews were conducted. Moving on to the analysis, which can be found on the 5th page of the article. All interviews were recorded and transcribed verbatim or word for word. NVivo 12 software was used to assist with data coding. 3 researchers were involved in coding the data. Similar codes were grouped under overarching themes to plot a thematic map of factors that facilitate or act as barriers to the implementation of bubble CPAP. What were the results? 46 participants were interviewed, with 58% being female and 65% were nurses. 5 barriers to the implementation of CPAP were identified. The authors provide excerpts from the interviews to support the 5 themes that can be found on pages 5 to 10 of the article. The first barrier being inadequate healthcare professional training. 25 of the 46 participants reported that they were not formally trained on bubble CPAP. Trained nurses felt training was inadequate. Healthcare professionals did not feel competent and had knowledge gaps in certain areas, such as weaning the baby off CPAP. The second barrier was identified as rigid division of roles and responsibilities among healthcare professionals. Medical hierarchy complicated decision-making as clinicians have greater authority to decide when a baby requires CPAP. Even when trained, some nurses reported reluctance to make decisions for fear of being questioned, which potentially delayed the commencement of CPAP. Lack of effective communication. Communication difficulties or gaps between clinicians and nurses and between healthcare professionals and the neonate's caregivers resulted in delays in starting CPAP. Human resource constraints further delayed commencement of CPAP and reduced monitoring of patients on CPAP. These shortages also made it challenging for healthcare professionals to have the time away for training. Lastly, inadequate equipment and infrastructure such as lack of electricity and consumables such as correctly sized nasal prongs exacerbated constraints around the use of CPAP. The authors describe the factors affecting the implementation of CPAP as interconnected. Factors that facilitate implementation of CPAP is described as comprehensive training, team cohesion, dedicated nurses for the nursery, and consistent availability of electricity and equipment. Which brings us to the conclusion. Both human and infrastructural resources are fundamental to effective CPAP use. Implications for future research. The authors suggest that future research to tease out implementation factors in tertiary versus secondary hospitals would help to understand the best ways to support healthcare professionals in different contexts. Also, to explore the implementation of mobile health approaches to support training and continued mentoring and coaching on bubble CPAP. Research should consider inclusion of decision makers and other cadres of staff with more influence on what interventions get implemented within the Malawian health system. Implications for practice and policy. To ensure optimal implementation of bubble CPAP, nurseries should be adequately staffed, providers should be offered ongoing training, and communication with caregivers and hospital infrastructure should be improved. We've come to the end of the video, and so now you need to access the article. The link is in the description box below, or maybe you already have a printed copy. We really encourage you to read the article in full, recognizing the parts that we have just summarized for you. After you've done that, consider the reflective questions here on this slide. If you are watching with colleagues, discuss your answers between you. Following that, take a moment to think about what you have learned and how you could apply it to improve nursing practice in your setting.